Hello and welcome to Impact. I'm Kenny Anderson, Director of Multicultural Affairs for the City of Huntsville, and it's my privilege to come on this broadcast from time to time and share information about wonderful things that are happening in our community. We're really blessed to be a part of a community that has so many different services, that care so much about people, and today is no different as I talk to some very special guests on the broadcast. The AIDS Action Coalition for over 25 years has provided remarkable services to people in our community that have spanned a range of things that are related to the issues surrounding the HIV/AIDS epidemic. And today we're going to talk with two individuals who work on the staff of the AIDS Action Coalition to catch up on what's been going on with their agency and also the disease itself. First of all, I want to introduce you to Mr. Adriel Johnson. Adriel, thank you for being on the broadcast.
Thank you for having me.
It's good to have you here today. Adriel is a prevention counseling manager with the AIDS Action Coalition, and you've been with them now for a minute.
Been there in my fourth year with the AIDS Action Coalition.
Yeah, and responsible for many different programs, and we want to talk a little bit about some of those things today.
Absolutely.
But we really thank you for being here and for the work that you do in the community. You brought a very special guest with you, Ms. Anna Santos. We thank her for being here today, and as a community resource specialist with the AIDS Action Coalition, and we welcome you to this broadcast.
Thank you for inviting us.
All right, and how long have you been with the agency?
A year. I started as a part-time outreach coordinator, and then I moved up the ladder into the housing department, and I work with other areas and stuff that we work with clients.
Well, that's awesome. You know, I think so much of the AIDS Action Coalition have had, I said it's been around for over 25 years. I think I've been around for as long as they've been around and have had many different kinds of opportunities to relate to this agency as a board member, as a supporter, and a variety of other functions. So I think so highly of this agency that provides such a valuable service. I think one of the first places I want to start, though, is to talk a little bit about the disease itself in 2014. It looks very different than it did 25, 26, 27 years ago. Talk about what's happening with the disease generally, and then bring it down to North Alabama and tell us what's happening in our communities.
Well, Kenny, you know, as you mentioned, you've been involved with HIV awareness for a long time, and so you're somewhat familiar with, you know, the progression of advocacy, of prevention, of treatment over the years. And we're in an exciting time right now because of all the biomedical, advantages that we have now that we did not used to have, where people with HIV are now living extremely long time with a great quality of life if they have access to treatment and care. But at that same token, we still have a long way to go because we're looking at new infections continuing to rise in our own backyard in the South. And especially within minority populations, we're seeing infection rates continue to grow also.
That's a question that people get a lot of times. Why are those infection rates continuing to increase in minority groups where other population incidents may be going down somewhat or remaining stable? What is your answer to people when they ask you, why are the rates of infection among minority populations continuing to rise in some instances?
Well, that's a multifaceted issue. But one of the things that we're fortunate to have now in the South is we're getting a lot more attention on the epidemic in the South, and we're getting funds for prevention. And for a long time, there were no funds for prevention in the South when the epidemic was growing. So that's one reason that, you know, the epidemic has continued, because the money was not necessarily where the problem was. The money was with a lot of the larger population centers, Miami, San Francisco, New York, when the epidemic was continuing to grow in the South. And also, you know, in the South, in the Bible Belt, there are certain topics that we don't like to talk about, including certain sexual behavior, for example. And so that has limited the message over the years. But we have made great strides, as you know, from where we used to be. And we have many partners, especially in the faith community, now that are actually talking about and addressing HIV and promoting awareness.
If I had to point to one thing that is vastly different from when I first started working in this community on issues surrounding this epidemic, that would be one place I would start, with the growth of the faith community's involvement in this discussion. Obviously, this is a disease that affects people, and people go to church. And so those two things go hand in hand. You have people, disease affects people, people go to church. So guess what? HIV infection is a part of your population. And so it seems to me from a point of pragmatism, as well as a point of faith, as well as a point of just reaching people where they are, that this is one of the places that people would find one of the most important groups of people to address.
Absolutely. And we have later this month, we have a collaboration with a group called Community Faith Partners, which you're familiar with also. And usually we have a great turnout for a large testing event we do in the summer with them, and we plan on having that go on this summer. And usually we test about 100 people. So we have a lot of faith partnerships also.
Yeah, I want to talk about the importance of testing here in just a moment.
Absolutely.
But I'm excited every year that the AIDS Action Coalition leads out on a number of these initiatives. Certainly you can be tested 365, 24/7 for the most part. And the reality is that if somebody wants to know their status, they can. June 27th is the National Day of Testing. It's a symbolic call in many ways to awareness, greater awareness, but it is also a call to action to get tested. Talk a little bit about why this particular event is so important, and it takes place in lots of places.
Well, National HIV Testing, as you said, is a day where we come together as a country and we promote HIV awareness and testing. And we also encourage individuals that are infected to seek treatment. And the AIDS Action Coalition 5 days a week offers free confidential HIV testing, and many people don't know that. And at this particular time of the year, we really make a strong push to encourage the community to come out, utilize our services, our HIV testing program, call us for community events. We have some community events going on National HIV Testing Day where organizations can call and say, hey, I want testing at my church, I want testing at my school, I want testing for my youth group, I want testing for just my community center. And we'll come out because it's very important that people know what their HIV status is and that testing is normalized so that we can break some of the stigma that is still around the disease of HIV.
Yeah, you know, you're mentioning something that I think is so important, the idea that no one has to be in a vacuum as it relates to questions about this disease. No one has to be in a vacuum as it relates to issues of testing and some of the stigma that you said that still lingers today in our communities. And the fact that you can have a National Day of Testing that brings attention to this. I know that the African American Awareness Black Testing Day is in February. The AIDS Action Coalition does lots of events throughout the year, different health fairs and other activities that are designed to help people become more responsible as far as their behaviors are concerned. And so there's no shortage of opportunity if somebody wants to know.
Absolutely. And one of the things that you mentioned when you asked why is the epidemic the way it is in the South, stigma is still one of those reasons. You know, a lot of individuals are afraid to access HIV testing services because of stigma of what happens if I find out my HIV status. Who do I turn to? Who do I talk to? What happens if someone sees me go in and get an HIV test? So it's so important to normalize that, and that's what National HIV Testing Day can do. And for communities of color, especially where there's a lot of stigma around many health-related issues, we always encourage communities of color to get tested. And my colleague Anna is putting together a health fair indicator for reaching out and targeting the Hispanic community because, again, that is also a community that has been hard hit by the epidemic in the South, and many times stigma is an entity that serves as a barrier to people accessing treatment, care, and prevention.
Yeah, Anna, tell us a little bit about that health fair.
Well, with this World Soccer game that's going on right now in Brazil, with all that going on, we've decided to have this soccer game also health fair. And it's basically like a community resource event. We're having all the information that we can have in Spanish for all our clients and people in the community. It's a free event. We're going to have bouncing house, face painting, we're going to have soccer games. Huntsville Hospital is on board with us, well, Decatur General is on board with us. We have mental health information, alcoholic abuse, all the information from the community. Sometimes because of the language barrier, people don't know that they are available for them. So I think that's why it's important to reach out to them, because it's a community that is really, really hit by HIV and other, health issues.
Yeah, now you both have hit on a couple of things I wanted to maybe talk a little bit more about. Cofactors as it relates to this disease. The idea that a lot of people can kind of walk through life with tunnel vision thinking that I'm not this, and they're putting themselves in a category. I'm not this, or I'm not that, not recognizing that there are various behaviors that they may be engaged in that would not necessarily put them in a category as they might see it, but would certainly put them at great risk. And you mentioned the idea of talking about alcoholism and substance abuse as a cofactor. You talked about some of the other challenges, Adriel, as it relates to health issues and conditions that can exacerbate an HIV diagnosis or an untreated case of HIV infection. So talk a little bit about why that's important to have a discussion about those things as part of this dialogue.
Well, I'm sorry. I think it's a comprehensive issue. I mean, if you have alcohol abuse, drug abuse, and then misinformation, I mean, that's a time bomb. So I think that we have to approach to any social situation, I mean, as a social worker, I see it that way, in a comprehensive way. I mean, if you attack every single issue by itself, it takes more money and more resources. But if you just go and hit the whole as a whole, then you can get more people to listen to you and to learn about the situations.
And you may say something that somebody they're shut down because they're hearing HIV, AIDS, sex. I don't want to talk about those things. Even though they may be engaged in those activities, they don't want to talk about them. But now you start talking about these other behaviors that they might be engaged in. And it may be things related to their lack of exercise, maybe related to their emotional state. It may be related to their alcohol or substance abuse. All of these other things that they can identify with that play into this whole issue of how people are infected and deal with the infection.
Well, Kenny, one thing we say in prevention, it's not about who you are, it's about what you do. And HIV is a virus, so it can impact potentially all of us. And that's one thing that we have to remember. And there are things that we do that can place us at risk. Substance abuse encourages sometimes risky behavior that can place you at risk for HIV. So it's important where we now, actually at the AIDS Action Coalition, have a state certified substance abuse program. So as of January of last year.
Wow.
So we're working with individuals that may have substance abuse issues also, so that we can help prevent possibly them from becoming infected. And as you mentioned with other health related issues, we know that the presence of other STDs or STIs places people at greater risk. And to go back to your question on why minorities seem to have a greater risk of HIV infection, one thing we know, particularly in the South, minorities have a greater rate of STD and STI infections. So that places you already at a greater risk for HIV infection also. So we're targeting all of these issues.
Yeah, I think the comprehensive approach is extremely valuable in this process and has the potential to cover so many different areas. Okay, so I go and I get tested. I answer the rallying call to come and know my status, and I take the test. And I want you to talk a little bit about the process because it's fairly benign. But then I want you to talk about what happens after the test, because it could very well be that somebody learns something that they're not ready to hear. And so talk about the process of going to get tested and then what happens after the fact.
Well, I can address that and I'll let my colleague chime in. The HIV testing process now is not the testing process it was 5 years ago, 10 years ago, 20 years ago. At one time, there was no test. But many people still don't know that our test is a 20-minute rapid test. It takes a couple of minutes to go ahead and collect the blood sample, and we do a finger prick. It's that simple. And then you wait 20 minutes and you have your results. And during that time, we also provide some pre-test counseling on risk factors, some education. And then we also provide post-test counseling afterwards when we're explaining the test results and what next steps need to be. And we try to refer people to services at that point that would be beneficial to them. So it's a process that's quick, it's easy, and you leave with more information than you had when you came in. So we really encourage people to know that it is just that easy and just that simple, and everyone should do it.
Yes, and we also, like Adriel said, not only the test, it just takes 20 minutes. I mean, we have people who speak Spanish for the people who doesn't speak English. We have people in different areas, depending on what risk the person is. We will address that situation per case basis. So we're here to help, and we just want people to come to us and get tested and to know their status.
Okay, so I'm going to connect the bridge now.
Okay.
I go get that test, and I do on at least 2 occasions a year. I do it around World AIDS Day, and I do it on National Testing Day, and for the most part, I do it in February as well, on Black HIV/AIDS Awareness Testing Day. So about 3 times a year I get tested. I know my status. I've known my status for a long time. So what I'm doing in a lot of ways is trying to be careful with my behavior and mindful of what I'm exposed to. And also, I'm trying to make sure that I set an example to say that this is something that you should absolutely know. You should absolutely know your status. It's not mandatory, but boy, how helpful it can be in terms of dealing with this epidemic. So my number 1 reason is example. Okay, so I set that example, and Adriel, you said it's about 20 minutes, and I tell you, that's a long 20 minutes. I mean, it seems like it may be 20 hours while you're sitting there and you're waiting, and there's that vacuum, and you don't kind of know, and you know, you're thinking about lots of different things, and so then somebody comes and gets you and tells you something. What happens in those instances when somebody gets a positive diagnosis?
Well, a lot of things go through individuals' heads when they discover that they are, in fact, HIV positive. I've had many individuals that say, I never thought it would happen to me. And that's exactly why we encourage everyone to get a test, because as we mentioned, it is a virus, so it can happen to anyone. But for individuals that do test positive, we try to provide them with information to let them know that there is assistance with medication. You know, there's a lot of misinformation that's still out there. There's a lot of information from 1992 where people still think, okay, that there are medication regimens that individuals that are living with HIV are taking that require dozens and dozens of pills. And for many of the patients that we see at our clinic that are HIV positive, they're taking 1 pill a day now.
Wow.
1 pill a day.
Wow, that's a huge change.
Absolutely. And that information needs to be out there in the community, because so many people still don't access treatment and care because they say, I don't have insurance. How can I pay for it? I don't have housing. How can I focus on my health care? And then we say, well, we have assistance programs. We help with housing also. So we try to give information when people find out that they are HIV positive, so that they can take care of their health.
What does it mean to both of you to work for an agency that for so many years has led out in advocacy, research initiatives, testing and treatment issues, has been a strong support system for people with HIV living in the community, have been a strong advocate for education? What does it mean to be a part of this group of people making that happen?
Well, it feels like a privilege, being lucky to do something that you really enjoy, being in a place that you feel appreciated, and then you're doing something to help the community. It feels very nice to be part of it and being able to say I'm proud of the agency you work for.
And it's really a great feeling to know that you make a difference. And there's so many things that you can do in life where you try and you try and try, and you can never see where you've made the difference. And I think working in this field, you can see in the lives of the people that you help when we help patients find housing assistance, or we navigate individuals to substance abuse treatment, and they come back and they tell you stories about how their life has changed, or individuals that we counsel on risky behavior that did not know that maybe the things that they were doing were placing them at risk. You get to see those changes. And one of our physicians at our clinic, you know, the AIDS Action Coalition runs a clinic called the Davis Clinic also for persons living with HIV. And one of our physicians talked about working with persons with HIV was so rewarding to him, because there's so many other diseases where you can't see a change in people's health. But with HIV now, with those 1 pill a day medications, we know that if we can get clients in treatment give them medical care, they can have what we call an undetectable viral load and have better health than you and I. And that is the miracle of technology in 2014.
Yeah. It's also very powerful, I think. And I know, Adriel, you've actually worked on some specific targeted groups programs as well. We got about 3 minutes left in the broadcast, but if you can give us just a little bit about what that's been all about.
Absolutely. In 2010, we were funded directly by the Centers for Disease Control, one of only 2 grantees in the state, and we're actually beginning our 5th year of that grant in July. So we're really excited because we hit the ground running, and we've been working with trying to reduce infection rates in the African American community, because in Alabama, new infections in the African American community are at an all-time high. So we wanted to try to have something proactive to work with that community. So we work with young ladies, we work with couples on communication. Our programs consist of goal setting. We refer individuals to other services, mental health services. We have an on-site psychiatrist if clients need that, those services also. And we target individuals that aren't already living with HIV, but persons that may be at risk in the community for acquiring HIV. So we're very excited about our targeted programs, and we hope that the support that we've gotten from the Huntsville community and the need that we've seen will continue to allow us to offer these targeted programs and be funded for another 5 years by the Centers for Disease Control.
Yeah, I certainly hope it is. You have a track record of proven success as well, which is great in terms of maybe re-upping on that process. No organization survives on its own. I know that you have a wonderful group of volunteers that support the agency. You got a very strong board that does that. So I just want to give a quick shout out to them. Absolutely. To say that I know you value and appreciate the work that they do, because they really know how to make it happen.
Absolutely. And we have a tireless CEO, Mary Elizabeth Marr, and a new executive director, Nicholas Carlisle, who spend hours and hours every week just going out in the community. And Mary Elizabeth is actually in D.C. now doing advocacy work, and she wanted to be here today. So we're constantly out there, not only in our own backyard, but out there on a national level, just trying to advocate for persons living with HIV and getting services down here in the South where we need it, where the epidemic is.
Well, congratulations to the AIDS Action Coalition, the AAC, for doing what it's done for so long. I wish this organization another 20 plus years, 25 plus years of success, and to go on and on and on, because you talk about organizations that are making a difference. This one definitely is, and I'm very grateful to have it in this community. We want people to know how to get in touch with you for information, education, seminars, testing, treatment, lots of different questions that people may have. And Ana, you may want to give some of that information in Spanish as well, if you'd like to, because we may have some Spanish-speaking listeners that are out there today.
Estamos en el 600 de San Clair y se pueden comunicar con nosotros al 256-536-4700.
All right.
And so we're located at 600 St. Clair Avenue. Our Prevention Services Department is in Building 7, Suite 18. And our telephone number is 256-536-4700. And that number is good if you would like to have someone come out and do presentations, you want HIV testing, or you yourself are HIV positive and you're needing treatment and care, or you know someone. So just give us a call and we'll be sure to direct you to the right person.
All right. And I know you've got a website and social
media.
Yes, and the website
contacts. Is AIDSActionCoalition.org. And we have Facebook. We have a Facebook page and many other ways to reach us. And we're active in social media also.
This organization is not hiding. You're out there working in plain sight. And once again, thank you for all that you do.
Thank you for having us.
All right. Adriel Johnson, he is Prevention Counseling Program Manager with the AIDS Action Coalition. And Ana Santos is the Community Resource Specialist. And we thank you both for being here today.
Thank you for having us.
We thank you for being a part of our broadcast. And as always, we thank you for sharing in this informational dialogue that we hope has made a difference in your life. Tell somebody about the broadcast and tell somebody about the great information that you're hearing. You can also follow us on Facebook at Impact with Kenny Anderson, and we hope that you'll take advantage to tune in with us and follow along with the dialogue. In the meantime, I hope that you have a great rest of the week, and we'll talk to you again soon. Bye-bye.